Hello, Canada. Danny Bulford, Mounties for Freedom. January 17th, 2022. Just want to show you a mini investigation I did into some commentary recently from some media personalities and from our federal health minister, Mr. Duclos. So first, January 13th, 2022, CBC Radio As It Happens. This is the episode transcript. You can scroll down here if you so choose to read it. Essentially, Carol Off leads off with acknowledging that the health minister has expressed that he's done accommodating people who haven't taken any of the injections, and that she asked, when can we expect a mandate? And he responded that, we have to be benevolent about it. Our experts are telling us that it's the best and most permanent way out of this situation, that the injections work. It's not about physically forcing anyone to take it, but that he also expressed that the mandates work as well for like provincial and federal organizations. Specifically, he mentioned the RCMP and the Canadian Forces when he was talking about federal mandates for employment. So, and that directly affected me, obviously, former member of the RCMP. Now, when he mentioned the mandates and how they were effective, he was specifically talking about how that resulted in 3 million additional Canadians uptaking and taking their doses. So when I heard that, I couldn't help but think, okay, they would have waited until this fall, like late this fall, probably, in order to take it to maintain their employment. And so that to me suggested that it was likely more a result of coercion from the governments, provincial and federal, as opposed to what they felt was the right medical choice for them. Now, what was not so obvious in response to his comments was that the mandates are effective at preventing infection, transmission, and outbreaks. As evidenced here, RCMP detachments across the country brace for pandemic-driven staff shortages. January 7th, 2022, CBC News. All double dosed. Hundreds of Canadian soldiers in quarantine amid COVID-19 outbreak. November 19th, 2021. Now, I know some may critique Rebel News, so I found almost essentially the exact same headline with CTV's around the similar date. Their headline just didn't include the fact that everyone would have had a double dose. Now, in the interview, there's two additional things that the health minister highlights. Of course, that a small percentage of the people are taking up all of the ICU and hospital beds, which I'll come back to a little bit later. But he also mentioned that mandates would not be intended to be punitive. It would be benevolent, and that would be removing the perks of life from people like me in order to incite, that was his actual word, and a little Freudian slip there, which he quickly corrected and changed to encourage people to take it. So when he said that, I couldn't help but wonder, perks. I can handle no restaurants, but do you mean these perks, Mr. Health Minister, are guaranteed rights and freedoms under the Charter and our Constitution Act, such as our fundamental freedoms, mobility rights, our legal rights, and the big one, boom, equality rights, equality before and under law, and equal protection and benefit of the law. And just a reminder, the Constitution of Canada is the supreme law of Canada, and any law that is inconsistent with the provisions of the Constitution is, to the extent of the consistency, of no force or effect. Now, seen some recency in the media from some personalities, such as Mr. Randy Boswell, doing a commentary piece for Global News here in Ottawa as of January 12th. Mr. Boswell is a journalist, and he's also a professor of journalism. And listen to some of the language that he uses. We should be pushing them extremely hard. We should be persuading and pressuring vaccine holdouts in every way we can think of, educating, incentivizing, penalizing, short of all-out public shaming, which is already happening, and this is kind of an example of that. or frog marching them to clinics and forcing needles into their arms. I don't really know what frog marching is, but marching anyone anywhere and forcing a needle into their arm, that does not sound very Canadian. And it's pretty concerning language coming from someone who's supposed to be a professional and who is actually, a professor in one of our universities. Here you have the unvaccinated cherish their freedoms to harm others. How can we ever forgive them? By Heather Malik, which is no surprise from the Toronto Star. They've written a number of pieces that have shown a complete disdain for people who've exercised my choice. Will we ever forgive the deliberately unvaccinated for having helped spread a disease that killed and disabled so many, devastating the economy, leaving many of us jobless and wretched? And then she cites the example of a young lady who's postponed her cancer surgery again because hospitals are packed with unvaccinated COVID-19 patients at death's door. So that's some of the terminology, some of the language that's being used in our what is supposed to be professional media sources, and from our federal health minister, who's supposed to be accurately relaying accurate information. So if you look at the daily report out of this is from Health Canada, I think it's the daily epidemiological situation report. As of yesterday, this is a big spike in Canada, smaller one in BC, slightly larger Alberta, and then of course Ontario and Quebec being the big ones. So if you look at the British Columbia information, 58% of hospitalizations are in people who've taken 1, 2, or 3 doses, as opposed to 42 who haven't taken any. Critical care, it's still predominantly people who haven't taken any, 66%, as opposed to the 34%. Deaths, however, this is significant difference from when I checked this website last week. 50% in no doses versus 50% in 1, 2, or 3, including a 25% death rate in people who've taken their third. In Alberta, current hospitalizations, the single, double, or triple dosed account for 63% of the hospitalizations. People who've taken 0 account for 37%. Now, again, Alberta, similar to British Columbia, if you go down to the table where it specifically talks about hospitalized ICU, hospitalized COVID-19 in the ICU in the past 120 days in Alberta by status and pre-existing condition, it is predominantly people who haven't taken any. So I think it's roughly about 84% to 16%, but vast majority in each category have underlying conditions. Now, the big drivers, and what I've seen, my observations throughout this time period have been that whatever you see in Ontario and Quebec initially is typically the trend that you will see in the following weeks in the rest of the province. So this is Ontario as of January 17th, today. So hospitalizations by status, 75% are in the partial and the fully. In the ICU, you're at 52% in the partial and the fully. Now, people who haven't taken any cases can still include someone who's taken 1, but they're within 14 days of their dose. And partial, same applies. They can have had their second dose, but they're within that 14-day time period. Now, about overwhelming ICU beds in the province of Ontario, this number here, 2,400 available. I'm pretty sure earlier in this declared pandemic, we had at some point bumped that up to, I think it was 3,600, but I'm not 100% certain on that. I know it was over 3,000 for sure. But now, regardless, we're down to 2,400 available beds. Out of that, the average in Ontario over the last month has been just over 76% or lower capacity. And about from roughly 10% to probably getting closer to 23, 24% of those patients are COVID related. In Quebec, if you look here, it has a significant uptake in 1 dose, 2 dose, like upwards of between 84 to 94%. And then probably a significant percentages in the more at-risk categories for the booster. Anyways, if you look at new hospitalizations over the last 28 days, out of this number here, 6,389, 71% of them have been in people who've are partial or double dosed. And similar in the ICU, 303, you have 67% of them are in partial or double. Now, adding on to the argument that we are overwhelming, that it's all our fault, that the hospital system is on the brink of collapse, and that we are the reason that people are not able to get their treatments for other illnesses or other ailments. Just like to show you a little bit of historical information from our trusted media sources. Sorry, I can't say that with a straight face. Ontario ER is overwhelmed as flu hits harder than usual, 2014. Hospital overcrowding has become the norm in Ontario, 2017. Overcrowded Ontario hospitals on the brink, province warned, 2017, even from our own Toronto Star. Hospital overcrowding crisis caused by more than just flu, says Ontario Health Coalition, 2018. 'Tis the season for hospital overcrowding, but the flu isn't to blame, January 2019. Why Ontario hospitals are full to bursting despite few COVID-19 patients, November 2nd, 2020. Our healthcare system has been on the brink of collapse every year for as long as I can remember. Even when I was growing up in rural Alberta, if you wanted to go to the Grand Prairie hospital, you're likely waiting. If it wasn't something critical, you'd be waiting in that waiting room for hours and hours and hours to see anyone. Now I'm reluctant to accept that argument because, number one, it's not a new issue. Our public health system has been under strain for a very long time, under-resourced, understaffed. When we were in the middle of the Delta wave, or throughout in the Delta wave still, you deliberately reduced capacity of the hospitals even further by pushing out capable, trained healthcare workers who quite possibly could have had prior exposure and natural immunity. And even if they didn't, just because some arbitrary date passed by in September or October or whatever date you implemented those mandates. Number three, your reporting data has not been obviously accurate, and government and public health officials in different provinces have admitted same just recently. They've admitted that possibly numbers were conflated, possibly hospitalizations were, they're starting to get a clearer picture only now of the people who were hospitalized in the ICU died of COVID as opposed to with COVID and multiple comorbidities. Even testing, the accuracy of the testing, all of those things have been questioned by our own public health and government officials that are, the biggest advocates of this strategy. What I think is more the case, or more likely the case, is that you have refused to accept that the public health strategy to date is a failure, and that it hasn't even followed our own pandemic response plans, federally and provincially. More to come on that in my next video. Take care. Thank you. Goodbye.